Hello, Arjun. I'm going to talk about my project is new value created as a result of COVID-19. And my content is about 4 chapters. The first website is about COVID-19, introduce the purpose of a research paper and what value created as technology. And the second one is literatures, profiling function and source of new technology. And third sector is materials and method. Introduce research instrument and verify feasible method. And fourth is conclusion. What summarize research paper. COVID-19 has become a global pandemic because of high transmission rates with a lack of effective case of treatment. At a global level, coordinated efforts by government concerned on containment and mitigation with varying degrees of success. Countries with low capital mortality rates of COVID-19 adapted to have a number of common strategies, including early surveillance, detection, contact trace, and strategic isolation in most successful countries. The scope, coordination, and data required to implement these strategies effectively depends on adoption and integration of digital technology in healthcare. This perspective offers a framework for applying digital technologies in pandemic management and response focus on how successful countries can use this technology for pandemic planning, surveillance testing, contact tracing, and recruiting and health. COVID-19 is a worldwide pandemic made by new health acquired respiratory syndrome coronavirus due to high infection rate, mortality rate over 1%, and the lack of effective antiviral treatment and for cases. The main focus of pandemic management is suppression and mitigation. Otherwise, despite relying on established public health processes, COVID-19 spread management success varies from country to country. Data health technology can contribute to pandemic countermeasures and response in ways that are difficult to implement manually. In 2020, South Korea and other countries, where government, including monitoring, detection, contact tracking, and strict isolation that may be related to early flattening of including incident curve, incorporated digital technology into coordinate containment and mitigation process. The death toll from COVID-19 is only 0.5% per 10,000, but in South Korea, it is only 0.5 per 10,000. The number of intensive care units has tripled USA. As for the objectives, the first question is, what is the advanced technology treated after COVID-19? Second is, what technology affected people's lives during pandemic of COVID-19? And third is, what value can created by such technology of social after a pandemic of COVID-19? So for my objectives is, first one, that is to know how technology treated has changed our life after the pandemic of COVID-19. Second is to research what technologies has profound effect on people's life during the pandemic of COVID-19. Third is to research what value of society was created by such technologies after the pandemic of COVID-19. Let's go ahead to step 2. As we see the chart of map, which is a source of literatures. Those countries are markedly back in the figure as many China, Germany, Sweden, Singapore, South Korea. Those are countries that use new technologies, while other countries markedly in blue that are slowly data resource regions. The first literatures review is planning and tracking big data and artificial intelligence facilitating the prevention, management, and tracking of COVID-19 in some countries, and the website adoption tools such as immigration maps gathering real-time data people's position using mobile phones, mobile payment apps, and social media, allowing government authorities to track the movement of the people traveling to Wuhan market. Wuhan is epicenter of the spread of infection. After the outbreak of in mainland China, Taiwan began health examination for air travels from Wuhan. Data from immigration records were integrated into construct real-time national health insurance databases. This allows medical institutions to keep track of patient movement and determine the distance between Taiwan and mainland China. And the second is screening for infection. Free web-based cloud-based tools to screen videos and decode them to wide results by Chinese. Taiwan airports have installed high-performance imaging cameras to take thermal images of people in real time and quickly find people living. For Singapore, people measure temperature at inherent entrance to work, school, and public transport, tracked temperature according data and use it to identify new hotspots and infection groups where you can start testing. Unlike many other countries, Iceland has extended testing for asymptomatic patients. This places a foundation of driving force of corporate police. Systematic screening is expensive and requires trained personnel, which limited in its use in many countries. This prevalence of latent and asymptomatic infection compared to other infections limited the effectiveness of digital vital signs and symptoms of self-reporting systems. Research as European Center of Disease Control and Prevention estimates that these factors prevent most passengers from being tested in urban areas of China. As finally, contact tracing Korea provides real-time information and detailed data time as people move using security camera license, facial recognition technology, bank card records, global positioning system data for cars and mobile phones, and more. By doing so, we introduced the aggressive contact tracking to sales crisis, saves an urgent mobile mail that a new coronavirus infected person has occurred in here, and instruct the inspection center of notify the person who may have contact with infected people and quarantined it. Singapore has announced a mobile app that allows you to exchange range Bluetooth since when people are very close. This app records these encounters and stores them on each phone for 21 days. Germany has launched a smart watch app that collects pulse, temperature, and sleep pattern data to screen for signs of illness. The contact tracking application is not without its pitfalls. Not all its process require quarantine. For example, if the exposed people is wearing personal protecting equipment or is is separated by a thin wall that can transmit mobile phone signals easier. Let's go ahead to chapter 3. This research will take qualitative research that health programs effective to help the government obtain timely information and effectively formulate epidemic prevention and country measures in order to provide the accurate and effective health data program and analyze. For the research instrument, we have 3 dimensions, and the 3 dimensions is called digital technology application, functions and operation of digital technologies, and pros and cons of digital technologies, and the source from COVID-19 global access from Johns Hopkins University, the Washington Post, and the European Center for Disease Prevention and Control. As a result of all and discussion, this will provide a framework for applying digital technology to epidemic management and response. For the trial, the function is trace patients or caregivers just in time. Advantage is collate epidemic prevention resource timely and establish corresponding measures. Disadvantage is human right violations, high cost, and loss of human oversight. Then the screening for infection is screen different groups of people and identify infected and non-infected. The advantage is provide personal health information and screening response. And the disadvantage is potential human rights violence require additional regulatory costs for individual based on their own reporting. Then the contact tracing is identify and tracks individuals who might have come into contact with an affected person. For the advantages is identify the pathogen in timely manner and trace its route of transmission. And disadvantage is it is possible to violate human rights, and there is certain probability that who has experience with closely affected persons who will found to have great obstacles in areas we have internet sites are not developed and mobile devices are blocked. As for chapter 4 is conclusion in terms of practice of countries that have flattened the coronavirus disease curve and maintained low deaths, maybe the integration of digital technology into epidemic countermeasures and response easier. Countries that deploy digital technology to facilitate planning, surveillance, testing, and contact tracing and clinical management using the competition to counter the spread of highly infectious viruses leading the way in controlling disease burden. Play a role the holistic response of countries have successed in deterrence and mitigations could provide lesson for the countries that still face